Stroke is the leading cause of death and severe long-term disability according to the American Heart Association. Permanent disability can potentially be lessened with immediate medical care. I'm Lauren Audie, and this is your Herald Health Minute brought to you by the Cape Regional Health System. The latest recommendations for emergent stroke care are important to understand, along with the warning signs of a stroke. Dr. Tuba Fayez, board-certified neurologist with the Cape Regional Health System, helped to explain the latest in stroke care.
So there's two types of strokes. The first type is an ischemic stroke, and the second type is a hemorrhagic stroke. Ischemic strokes account for about 87% of strokes, so they're the much more common type of stroke that occurs in the United States. Ischemic strokes are usually due to a clot that causes blockage of blood flow to an area of the brain, and whereas a hemorrhagic stroke, you have a weakened blood vessel that ruptures and you get bleeding within the brain. The major risk factors for stroke are high blood pressure, high cholesterol, diabetes, obesity, atrial fibrillation, which is an irregular heart rhythm. I always tell everybody that if you have any sudden symptoms, that is a sign for a stroke and you should be evaluated. So sudden headache, sudden weakness, sudden numbness, sudden speech changes, you can't talk or your speech is slurred, sudden vision changes, you're seeing double all of a sudden, you lose your peripheral vision or an area of vision, balance difficulties, sudden vertigo or dizziness. Those can all be stroke signs and symptoms and you should be evaluated for it. A lot of people have a misconception that with stroke you have to have pain or you have to have associated weakness, and that is absolutely not true. The symptoms can be very subtle at times, so it's important that if you notice something different to just come in and be examined for it. The other misconception that a lot of people have with stroke is that the symptoms will resolve on their own. So we have a lot of people waiting to come in to be evaluated, and that can be of detriment as well. So as soon as you're symptomatic, you should call 911 and come to the hospital. One of the first things that will be done is you'll be evaluated by an emergency department physician and also be sent for a CAT scan. The importance of getting that done so urgently is so we can differentiate between the ischemic and hemorrhagic type of strokes.
Recognizing stroke symptoms and seeking emergent medical care is critical to stroke prevention and management. Maintaining a controlled blood pressure is also key even when not symptomatic. Many people with high blood pressure don't even know they have high blood pressure. Therefore, it is worth having your blood pressure checked regularly and take prescribed medications as directed. For more Herald Health and Wellness reports, visit the CapeMay-County-Herald.com and click the Lifestyle tab. This health video has been brought to you by the Cape Regional Health System. For information on services and for a healthier life, call 609-463-CAPE.